let's talk about our third type of hematological cancer, multiple myeloma. Multiple myeloma is a type of cancer where the plasma cells invade or infiltrate the bone marrow and end up destroying the bone marrow. It is a fairly uncommon type of cancer, representing about 1% of all malignancies and about 15% of hematological types of cancer. There is a higher incidence in men over women and also African Americans over whites. It develops typically over the age of 40. Again, similar to other heme cancers, the cause is unknown, but there are risk factors that exist. Environmental exposure to organic chemicals such as benzene and herbicides or insecticide exposure, radiation exposure, obesity, viral infections, and genetics also can play a part in the development of multiple myeloma. So what happens in multiple myeloma is there is excessive production of the plasma cells, which are the activated B cells. They normally produce immunoglobulins or antibodies. These normally help fight off foreign bacteria in our bodies and help protect us. But in this case, the cells that are taking over and are replacing the normal bone marrow are considered monoclonal types of antibodies. Monoclonal indicates that the cells all look the same or are undifferentiated, and they are inactive, which means they're unable to fight infection. They can't do what they normally do, and instead they destroy the bone of the bone marrow and infiltrate other organs such as the kidneys, the spleen, the liver, the lymph nodes, and the heart. In addition, there is excessive production of cytokines from these plasma cells that cause further destruction of the bone. The development of multiple myeloma is gradual, and so the disease is many times not diagnosed until it is pretty far advanced. The patients will experience bone pain as a major symptom, and especially in the pelvis, spine, or rib bones. This pain can be triggered by movement or moving around. The patient will show signs of osteoporosis as more and more bone is destroyed, and lesions will become present in the skull, the vertebrae, and the ribs. The patient may experience collapsing of the vertebrae, which will compress the spinal cord, and they will also have an increased risk of fractures, or they may have fractures present that they don't know about. Because of the bone destruction, calcium is released from the bone and into the bloodstream, which will lead to hypercalcemia. And this will have effects in other parts of the body related to the high levels of the calcium. The patient may have confusion, seizures, coma, and they can develop renal and cardiac issues from that high calcium level. The patient will have presence of the monoclonal antibody proteins. These are called M proteins. They make up part of the protein of the antibody. There's also the Bence-Jones proteins, and these make up part of the chemical structure of the monoclonal antibodies as well. And so the M proteins build up in the blood, and the Bence-Jones proteins can be detected in the urine. They can pass through the kidneys. They cause a lot of damage to the tubules of the kidneys and plug up the nephrons. All blood cells will be decreased, so you'll see anemia, thrombocytopenia, and neutropenia in these patients because of the replacement of the normal cells with these monoclonal plasma cells. So those are your big time manifestations with multiple myeloma. So blood studies that will be done include looking for the monoclonal proteins. They will look for the tumor marker, which can be detected in the blood. You'll see an increase in those M proteins. They will be checking for the calcium levels and the creatinine levels in the blood. What you'll see is hypercalcemia. You'll also see an increase in creatinine. And then that drop in all those blood cell levels. So you'll see pancytopenia. The Bence-Jones proteins will be present in the urine as evidence of the plasma cell monoclonal antibodies. They will also typically do a bone marrow biopsy to examine the tissue, and that bone marrow will show increase in those plasma cells. Scans will be done, MRIs, PET scans, CT scans, and they will show bone erosion or thinning. They will also show possible fractures present in those bones that we talked about, especially the pelvis, the ribs, and the vertebrae. For staging purposes and prognosis, they will do diagnostic markers, and they are specifically looking for the beta microglobulin and albumin levels. And this diagram here on the slide shows you kind of what they're doing. They're looking at the albumin and specifically the beta microalbumin levels. Low albumin levels and high beta microglobulin levels does indicate a poor prognosis for the patients with multiple myeloma. So that's just one specific diagnostic feature that they're looking at, and that helps them stage the illness and figure out prognosis. So treatment for multiple myeloma is it's a combination of drug therapy. Unfortunately, there is not a cure for multiple myeloma. We can reduce the symptoms and help prolong the lives of the patients, though, with this drug therapy. Chemo is used to rid of the plasma cells, get rid of those monoclonal antibodies. Using high doses of chemo in combination with steroids. A common approach is to do a stem cell transplant following the high doses of chemo, if the patient is able to tolerate that. Biologic and targeted therapy is also used similarly to other hematological cancers. And if the treatment is working, there will be an improvement in those normal plasma cells coming around again. There will be a drop in M protein and the Bence-Jones proteins that are found in those monoclonal antibodies. So there are some significant complications of multiple myeloma. Osteoporosis being a big one with that bone destruction that's occurring. Kidney failure with the different proteins, especially the Bence-Jones proteins, filtering through and causing that intrarenal damage, if you remember that from our kidney unit. Hypercalcemia, again, that is occurring because the calcemia is coming out of the bone from bone loss and into the bloodstream. So the complications related to hypercalcemia. And then finally, we also have this hyperviscosity syndrome that can occur, and this is related to those high levels of circulating plasma proteins. They can start clogging up the blood circulation, leading to thromboembolisms and other issues with circulation that can then affect the kidneys, can affect the neurological system. So this is another type of complication related to multiple myeloma. So we want to try and treat those complications because they are so serious. We have to address these at the same time that we're addressing the cancer itself. The patient may need to have a kyphoplasty, which is a type of procedure where they inject a bone type of cement into the vertebrae to prevent collapsing from occurring. And you can see from this diagram that they're trying to rebuild that vertebrae. This has helped with that erosion in the spine to prevent compression of the spine. And then education on how to prevent fractures is really important for patients, such as increasing weight-bearing exercises, increasing ambulation. Radiation might also be a possibility for these patients to help with bone pain. They will do localized radiation for that specific area that might be causing a lot of pain for the patients. Bisphosphonates are a type of drug that are used to treat osteoporosis and similar diseases, and it's a drug that's given IV to help with the bone loss, help with decreasing that bone breakdown. It can also help with bone pain and with hypercalcemia that's occurring there. And then to help decrease the decreased kidney function, it may be necessary to give furosemide to help the kidney functions, but help the kidneys function better, and can be used to help remove some of the excess calcium. Hydration, also important to flush out the kidneys and to flush out the proteins that might be building up in the nephrons. And hydration is also important for that hypercalcemia. And then finally, plasmapheresis may be also used if there is a large amount of plasma protein circulating in the blood to help with that hyperviscosity syndrome. They will actually have plasmapheresis to remove those proteins from the blood circulation. So these are your big complications. This is how we treat them in addition to treating the cancer itself with chemotherapy